It's so nice to have all of you here this evening. Thank you so much for joining us and welcome to our Autism Exploration series. I'm Emily Stampone. I'm the Clinical Director of Field Services here at Verbal Beginnings. Verbal Beginnings' mission is to change lives for our clients, families, and our professionals. And we do that through our pledge of care, which is our promise to you to provide effective treatment through compassionate care. And we also strive to achieve our mission through our core values. One of our core values is education, so teaching families valuable ways to work with your child. And that's really why we decided to start these series. And we're really excited to have you joining us this evening to talk about community integration. And additionally, you'll see the seal below here on the screen from the Behavioral Center of Excellence. This seal represents the hard work and focus that we place to ensure that Verbal Beginnings is providing quality care through the highest standards. And we continue to receive this accreditation and strive to do better each time. We can move to the next slide, Kaitlyn. Thank you. I also wanted to take this opportunity to introduce you to the different services that we offer here at Verbal Beginnings. In addition to our in-home and center-based ABA services, we also offer diagnostic services, feeding therapy, and social skills programming. Additionally, just a couple housekeeping items to keep note of for tonight's webinar. We want to encourage you to please participate with us today throughout the presentation by using the Q&A feature found at the bottom of the screen. Your microphones and videos will not work during this just because it is a webinar style. So if you do have questions throughout the presentation, please use that Q&A feature. And we'll also be launching polls, a couple polls throughout these webinar this evening. So please feel free to participate in those that occur as well. We also offer closed captioning during this recording, which you can access by navigating to the bottom of your Zoom screen and clicking the closed captioning button on the bottom of your screen if you're interested in that. And without further ado, I'd like to introduce you to our presenter for the night, Kaitlyn Chewey. Kaitlyn, it's all yours.
Thank you, Emily, and thank you everyone so much for joining. So excited for all of you to be here and really passionate about this topic that we're discussing tonight. So again, thank you for attending. So a little bit about me, so you know who you're working with tonight. I'm a licensed behavior analyst, and I am a current regional director at Verbal Beginnings. I do have extensive experience working as a special educator and also in a BCBA in both the public school setting and non-public setting, specifically working with kiddos who have autism. I spent a number of years actually working at Verbal Beginnings, doing in-home therapy and family training. And as I already mentioned, I am most passionate about increasing the quality of life for those with autism, as well as for their families, and finding some meaningful ways that they can integrate with their communities. So a little bit about me. I also have a picture here. You can see I shared a little bit about my professional life, but a little about my personal life. I have a 1.5-year-old little boy and a golden retriever that I love so much. So they are joining us on this slide tonight. So let's get started. All right. So our agenda, what you can expect for us to cover and discuss tonight is we're going to go into the importance of community integration. We're going to talk a little bit about what community integration for those with disabilities and autism specifically has looked like in the past, where it is now, and what it's going to look like in the future, hopefully, and where it's going. We're also going to discuss some barriers and challenges that our children face in the community, and then some helpful parent-friendly strategies that hopefully you'll be able to take with you today and implement at home with your families, in the community, with your child. And then at the end, we should have some time for some question and answer. So if you have any questions, as Emily mentioned, you can, throughout the presentation, add them to the question box, or you can wait till the end of the presentation as well. All right, so why? Let's start with the why. Why is community integration so important? Well, when I think of community integration, when I've worked with all of my families of children who have autism or any related disabilities, is quality of life. Right? I have a quote here that states that autism affects an individual, but it also affects the entire family. So when children with, autism appropriately are able to tolerate and effectively access various settings and community environments, it helps to open up so many doors for their families, right? It helps, prevent some of that isolation that families can and caregivers can sometimes feel because of how difficult those community outings can really be sometimes due to some of the behavioral challenges we see or some of the skill deficits that our kiddos may have in those settings. And, it really, it expands their quality of life, and it also expands everyone's world when we're able to integrate effectively, right? The options are limitless. Along with quality of life, it also creates so many natural learning opportunities, right? The more we're able to get our kiddos in various environments in the community, whether it's dental offices, going to malls, concerts, parks, birthday parties, they're able to build different skills and have more learning opportunities for things like building independent living skills, right? We can have opportunities in the community to practice purchasing skills. That's a life skill. We have opportunities to go to different bathrooms and learn how different sinks work, right? Some are automatic, some you have to turn on, how different paper towel holders work. There's so many different ways that we can, naturally teach our children independent living skills when they're in the community. Along with that, there's so many social learning activities that they can benefit from by just being more integrated into the community. So that could be, some social pleasantries, saying hi and goodbye, identifying stranger danger, who to talk to, who not to talk to, right? I can go and talk to a fireman if I'm lost, but park who's crying and sad and maybe they're tantruming and they know those are signs that maybe I shouldn't approach that kiddo. They're having a hard time right now, right? So there's different emotional learning activities that they could benefit from. And also physical learning. So going to the park, again, my park example, they can learn how to climb on a playground and try different play sets and be better able to play with peers in those different environments. And finally, another reason community integration is really important is it provides opportunity for more engagement and more meaningful interactions with the people in their lives, right? So it gives more opportunities for caregivers to have more meaningful, fun, active, interesting interactions with their families, with their siblings, and also with peers. So community integration is important, and we're going to talk a little bit about what it looked like in the past and kind of where we're at now with it. So historically, inclusion and integration really focused on the school setting, which is really important, right? The least restrictive environments for our kiddos, really important to think about it in the school setting. But there's been a bigger push recently across research that we want to promote community integration for those with autism and their families across different environments, not just in school, but in all environments, right? It's important for the kiddos, it's important for the families, right? It all comes back to that quality of life piece too. So you may come into contact previously, or you may in the future come into contact with, there's more opportunities for inclusivity, such as sensory friendly events and environments. I know there are some places you can go get your haircut and they'll have a sensory friendly day where, there's quiet spaces for the kiddos, there's sensory friendly music, there's some fidgets for them to play with, which is awesome that we're starting to have some of these things integrated into different activities, across different community settings. There's also been, more recent modified hiring processes, more accommodations in the workplace. All of these things are awesome. And all these things are going in a really positive direction. However, they're not perfect yet. We need more. We need more less separate activities, right? And more inclusive activities and figuring out ways that we can coach and teach, different professionals and people how to interact and engage those who have autism and be welcoming to them and their families as well. So I have a note here too, there is a big need for providers and professional education to create more trauma-informed care. So right now there is some, based on my research, there is some, you know, physician programs, dental programs, where people are getting their PhDs, and there are some training and classwork on, how to work and make accommodations for those who have disabilities. However, it's not extensive, and I think there's a lot of leg room for growth in that area. There's a big gap there that continues to need to be filled. But, in the meantime, I think it's really important, while that research is still developing and those things are still being worked on getting implemented in an effective and meaningful way, that we as caregivers and family members and parents are learning how to start implementing strategies that make these outings more meaningful, and, less of an effort. So let's get into one of our first polls. So your participation is greatly appreciated. Our question here is, do you ever avoid going to various community locations with your child who has ASD? You can say yes, no, or sometimes. All right, Emily, are we getting some answers coming through?
We are. I'm just going to give it just a couple more seconds here in case anybody else wants to respond, and then I'll share the results.
Wonderful. All right, so I see a lot of yeses. I see a lot of sometimes, and then I see no nos currently. Well, you're at the right place, because I think, I'm sure those who have sometimes or have always experienced difficult interactions in the community, are looking for some strategies that could be really, really helpful. And we're going to talk a little bit about the barriers that our kiddos face and why they may face those barriers, so that we can understand that a little bit more. And we'll go into the strategies, but it's good to see that, you're all here with a purpose, and you're really here to learn some of those strategies, so that we don't have to avoid going on these different community locations with our children, right? We want to expand your world. We want to make sure that you feel good whenever you're in the community with your kiddos. So let's continue on. Thank you for participating. We have another poll coming up. So here are some examples. I just wanted to share a few examples of community locations that maybe you have taken your kiddos to, maybe you haven't. Maybe some of these locations have been difficult for you in the past and are kind of, sticking out to you. Or maybe some of these are ones that your kiddo actually really likes going to, right? It doesn't mean, one size doesn't fit all here, but maybe, as an example, restaurants is an area that you really want to focus building tolerance for your kiddo. Maybe, it's always, a tantrum when it comes to mealtime out in, Applebee's, and you always get a tantrum. Or, maybe you even just want to fade having the iPad at the dinner table, or not. Maybe you have a really hard time with haircuts. Maybe there's always a tantrum, or they're running out of the room and it's always chaotic. And it brings parents or caregivers a lot of stress when there's these specific environments that you need to go to, and you feel like you can't be successful because there's some challenging behaviors or some skill deficits occurring. Maybe you have your kiddo enrolled in soccer practice, or they have a sibling who is in soccer practice and you need to bring them with you. And that's always a scary event, because, you're supposed to be attending to one child, but you're having difficulty behaviorally with another. So a bunch of different examples here, but I'm hoping that some of these stick out to you, and keep some of these in mind as we kind of go through the rest of our PowerPoint, and kind of think about some of those areas or those community settings or locations that your kiddo or you struggle with kind of managing, their behaviors or their skills. And we can think about that as we apply some strategies today. All right, so before we get into the barriers, I want to kind of see what some of the barriers you face when you're in the community with your child. So you may experience all of these, but Are you experiencing some behavior challenges? Is it skill deficits? Is it both? Or are you experiencing something completely different from what was listed? So go ahead and answer that, and then we'll let some answers fall through, and then we'll look at what the results are there.
I'm going to give it another 10, 15 seconds.
Awesome. All right. So this is good to see. So it looks like about almost half of you, 40%, see a lot of behavioral challenges. We're seeing some people who only see some skill deficits, which I thought would be true as well. And then some of you are seeing both, some behavioral challenges and skill deficits, which they kind of go hand in hand, right? And then some of you said other as well. So that is awesome. I'm glad you guys were able to share that. And we're gonna talk through how to navigate some of those challenges, and again, kind of go into some of those strategies. But thank you for sharing your responses there for me to see and to share with everyone else. All righty. So let's talk a little bit about the barriers that those with autism face in the community. So, like we just kind of brought up, challenging behaviors can occur when in the community setting, especially when our kiddos don't have coping strategies or replacement behaviors that haven't been explicitly taught to them, or maybe they're working on them at home but they haven't been able to generalize them yet to the community. They're not quite ready. They don't have a lot of tools in their toolbox yet, right? So sometimes that is the case, and you'll see some behaviors. For example, you may see some vocal protests like, no, I don't want to go. You may see some elopement, which means running out of the room, running away, tantruming, crying, yelling, whining, maybe some aggression, maybe hitting, dropping to the floor, being weightless. There's so many different behaviors that could occur, and a lot of these can occur together sometimes, and it can be scary and it can feel frustrating and can, just be stressful for caregivers or family members, right? So it's important for us to understand that these behaviors that are occurring, they're happening for a reason. They're not happening just willy-nilly. They're happening they could be for so many different reasons. And I listed a few of them here. So it's important to know why they're happening. So, well, first of all, something that like I mentioned before, they may not have the words to say, no, I don't want to do that. I don't want to go get my hair cut right now. I don't want to get a shot. That's scary to me. May not have those communication skills developed just yet, or have a meaningful way to communicate that. So the behaviors are their way of communicating how they're feeling. So some examples of reasons these challenging behaviors could occur. It could be, one, denied access to something they want. So an example of that would be you're in Target, you're shopping around, you're going for the food store today, you're just grocery shopping, but you pass the toy aisle, or there's just a toy in the middle of the aisle, and you are not going to give them that toy today. It's not the reason you're at the store, and you have to say no. Being denied access to something that they really want can create or evoke some of that challenging behavior. Another reason the problem behavior could occur, again, there could be so many reasons, but could be wanting to escape the task or activity. So maybe you're bringing them to basketball practice and they don't want to go. They don't have the words to tell you or any coping strategies to kind of prep themselves to go or get through the event. So they engage in elopement behavior. They're running away from the basketball court, wanting nothing to do with it. Another reason could be escaping the attention of others. I've had experiences in the past where I've worked with families, and we've had a kiddo who we would go to Walmart to practice interactions because there was a lot of elopement and we didn't quite understand why, but we found that it was, passing other adults or children in the aisles at Walmart would create some elopement. She was trying to avoid going and being around other people in that environment. So running away and hiding was, the behavior. That's how they knew to handle it. So we had to work on different replacement behaviors. And we'll get into that. Another reason could be difficulty gaining the attention of others. So maybe you bring them to the park, or you go to my gym or a different play place, and they try to approach peers and they're saying play, 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 but the peers don't understand and run away, aren't really engaging. And right there, they're being denied the attention they're trying to gain, and that can create problem behavior as well. Or, it can be the behavior can be controlled by multiple of the reasons that I've listed here and others. But it's important really is to know that, these behaviors are not happening just because they're happening because there are some deficits related to coping strategies, replacement behaviors, communication that they need to be explicitly taught, both in the moment and outside of the moment, before an issue would occur, to be able to navigate these challenging situations that may arrive in these different environments more effectively. So some skills that should really be prioritized and generalized in the community settings are communication skills. So being able to, state how they feel, state what they want, um, being able to say no, being able to say they feel sad, being able to say, when can we leave? Another skill is replacement language and behaviors. So instead of crying, screaming, dropping, maybe, using, again, language, or saying, I don't want to go there. Or just tolerating, tolerance training, tolerating when told no or not right now, being able to say, well, when can I have it? Or when can we leave? Compliance training. So being able to slowly comply with whatever, demands the parents are placing, okay, it's time to wash your hands. We're in a public bathroom. It's time to wait in line. We're at the grocery store. We need to stand in line. So getting them to comply with some of those directions that the caregivers are giving. And then again, social pleasantries or social skills, being able to build those up so that they feel more confident and being able to interact more effectively, whether it's on a communication device or with sign language, or, through vocal communication. This, all of these things, no matter, what skill level, there's a way we can work on these different activities. All right, last poll for the group. Do you feel like you have the necessary tools to help you navigate your challenging situations that you've faced with your children in the past? I know we all have some, based on the previous polls, we've had some difficult times in the community. Not always, but sometimes, right? And in those difficult moments, do you feel like you had the necessary tools to kind of navigate those tough situations?
We still have some people responding, so I'm just going to give it another few seconds here.
All right. Okay, cool. So it looks like there's a few yeses, which is great. It looks like you're working on some skills maybe at home, working on generalizing those. Excellent. But then it looks like a large majority didn't feel like they had the tools necessary to navigate those difficult scenarios and situations. And you're not alone. It's not, in our written parent rule book, right? It's a learning process, and there's skills that the parents need to learn, and there's skills that our kiddos also need to be taught and learn. So let's delve into some strategies now, that will be useful for both the family and for the child. when navigating these situations. So where do caregivers start? All right, well, we're going to start small. We're going to start slow and steady. So what you're going to do is you're going to start practicing going on different community outings where you feel more comfortable and confident. So that could mean for you going to an environment that has less people, more space, maybe fewer distractions. Maybe you go to a park that's more, there's not as much foot traffic, or a store that doesn't have as much foot traffic. Maybe a park that's more enclosed, right? Maybe starting slow and building your way up to like a park where there's tons of children and more open space, right? We don't want to set ourselves or our children up for failure. So when we're really starting to get going and practicing, getting comfortable and teaching some of these skills to our kiddos in different environments, starting small is key. But it is good to have a goal in mind, right, of where you want to go, right? But slow and steady, small steps. Once you conquer going to that location that you feel really comfortable and safe in, maybe you even bring, extra backup. Maybe you bring grandma or grandpa or a friend that kind of can help support you if things do happen to get difficult. But starting small, slow, and steady is my first step that I would recommend. The next step is to adjust your expectations. Okay, so one thing I like to say is raise acceptance and lower expectations. And this takes practice, right? So we may, want our kiddo to be able to, go to Chuck E. Cheese for a birthday party, interact with all their friends, and be an active participant in all the games, and do all the toys the right way. But they may not be ready for that just yet. We have to adjust our expectations and know, okay, this is where my kiddo skills are now, and let's work our way up to that, right? Or let's see another one. Maybe you want to go to a concert, right? And you want to bring them there, but there's loud noises and there's a lot of people at concerts. And, that's something that, maybe we need to lower expectations, say, okay, we're not ready for that yet, but let's work our way up. Let's start small and build our way up there and teach them the skills necessary to get there, right? Again, we want to make sure that, we're keeping them successful. And it's important, I think, for parents to really, when adjusting your expectations, picking an affirmation that, you say to yourself during challenging situations. One that I say to myself in challenging situations is raise acceptance, lower expectations, raise acceptance, lower expectations, right? I mean, I have a toddler. I understand, sometimes we go into community outings and it's a really tough time, right? Maybe we didn't get all of our naps in, maybe we're hungry and, it's a perfect storm. But thinking of some kind of mantra or affirmation that you can say to yourself to kind of talk yourself through some of these challenging or difficult situations that you face or you may face with your children, and giving yourself some grace there. And figuring out what strategies help you work through some of these challenges. So I just said saying an affirmation over and over in my head is something that helps me kind of stay focused and get through. But that may not work for you. You can, try some things like planning ahead, right? And maybe you give some deep breaths throughout those situations, right? Maybe there's certain toys that you keep in your pocketbook that you have prepared and that you're ready just in case, you need backup, right? So starting small, adjusting your expectations, which is okay to do. You don't have to, lower your expectations for good. It's still good to have goals and, want them to reach for the stars, but we have to start incrementally, right? Build them up. Keep them successful is key. And one thing we're going to spend just a little time talking about is we're going to make SMART goals for ourselves and your child to help you kind of visualize your success. So creating these goals, they're goals that are going to be specific, measurable, something that's reachable and attainable, right? It's not going to be something that's so crazy big that we're not sure we can get there just yet. We're going to make them realistic and time bound. So SMART goals are It's kind of an acronym here. So S stands for they're specific. So you're going to set real numbers with real deadlines. And I have an example of what a SMART goal I wrote looks like. So as caregivers and parents, you're going to think about, a real number with real deadlines, and you're going to pick a goal that's trackable, right? So you're also going to work towards a goal that is challenging but possible, and create some steps to get there, and be honest with yourself. Know what your kiddo and your family is capable of doing, and giving yourself some deadlines, right? So all of these tips are really just helping to make your goal attainable and reachable and measurable, and something that you can see grasping in your future. A goal for your family, a goal for your kiddo, a goal for you. So when talking about SMART goals, I have a little scenario here. So let's say your child engages in screaming, crying, and tantruming behaviors during haircut appointments. So specifically when scissors or buzzers are used, those tools are very scary to your child here. And they, the second they walk in to get their haircut, they see those items and they engage in all the challenging behaviors. So maybe in your mind, you're like, okay, I'm going to start small. I'm going to create a SMART goal, and I'm going to nip away little by little here and figure out if I can make some meaningful progress with my kiddo. So before you can start working on, a specific community outing or, procedure with your kiddo, you want to create a goal. So think in your head right now, kind of a goal. But for this scenario, I wrote that for my kiddo, I will set aside 15 minutes 3 times each week to work on desensitization to scissors, buzzers, and hair cutting with my child, so that they can tolerate a simulated haircut for 5 minutes in the absence of any challenging behavior. So that's a loaded one, right? But it has all those really meaty, important things. I'm holding myself accountable that 3 times a week for 15 minutes, I'm going to play on the floor, role play with the buzzer, turning it on, turning it off, letting him hold the buzzer, letting him, point to the scissors, right? Maybe not hold the scissors. I'm going to show them videos of getting haircuts. I'm gonna use a brush on the hair. I'm gonna have all steps to working towards that. And again, we'll get into strategies, but the first thing is kind of coming up with that overarching goal so that you can visualize these are the things that are going to really help my kiddo tolerate some of these really challenging and scary tools that they normally see at getting their haircut. And this is how often I'm going to be working on them with it. And, by the end of it, they're going to be able to sit there for 5 minutes with no problem behavior, right? And maybe once they master that, I'm going to have them do it for 10 minutes with no problem behavior and sit there. And after that, I'm going to bring them to the haircut and just have them practice sitting down in the haircut chair. So, we can expand on these, but I think coming up with a goal of a location, thinking of a place that you particularly have had difficulty with, kind of integrating your child or your family due to problem behavior or skill deficits, right? And, coming up with a goal that, you feel like would be attainable. So that's a SMART goal. Let's kind of move on a little bit here. All right. So along with what I've already shared, there's some teaching strategies that we can utilize with our learners. So some of the things I shared previously are things that the caregivers can implement for themselves and to help kind of manage those situations, those emotions, right? But now we're going to talk about our learners and how can we teach our learners to tolerate, to comply, to navigate some of these situations. Some of the skills we're going to talk about and kind of build up your toolbox with. One of the things is called priming. Another is exposure trials, which is one of my favorite. Role play, and also giving choices. We're going to delve into each of those in way more detail. And I do want to add a side note that not all the strategies that I've listed here are appropriate for all learners. It is recommended that you consult with your BCBA, home team, or school team about some of this and what would be kind of the most appropriate strategy to use for your kids. But these are really, really beneficial, research-based different strategies that can really help teach your kids the skills they need so that they can integrate, you know, into the community, whether it's for social gatherings or, you know, for procedures like dental visits, hospitals, haircuts, all those things. Okay, so the first skill we're going to talk about is priming. And it is kind of what it sounds like. It's prepping your child before the outing so they understand what to expect or what the expectation is. So I like to say that a good time to do this is really maybe before getting out of a car or before leaving your house. So for the example I brought up earlier, for my friend who had difficulty in Walmart, right, going in and out of the aisles, was avoiding people, before we got out of the car, I said, okay, we're at Walmart. What are our rules? And we had a visual representation of the rules she was able to read. But again, this could be adaptable for someone who couldn't, with pictures, or there's another strategy we could utilize here as well. But we would say, okay, before we get out of the car, remember, we hold mom's hand or the cart. You know, we ask before leaving mom, you know, we ask to see toys, whatever the rules were, we would list them, the ones that we found important, and had her read them back to us. And that kind of just helps set the expectation of, you know, what we expected her behaviors to be in that environment. It's also really helpful to incorporate really highly motivating reinforcers here. So remember, we follow all our rules. We can, you know, go to the playground after, or something that's really motivating and exciting for them. Remember, after we go to Walmart, we can, you know, go visit your friend at XYZ. So just thinking of something that's really motivating. Every child has different interests. So it is important to know what excites them, what motivates them, so that you can utilize some of that language, which leads to another priming strategy is using first then language. And I'm sure some of you have heard that before, but there is power behind it, right? So some kiddos can benefit from you just saying, first, we're going to Walmart, then we can go to the playground. Some kiddos benefit more so from that being in as you see my visual below, the first visual is a first then chart. First, we're going to the doctor visit, then we're going to the playground, just so that they understand, you know, what we're doing now and then what can come after, right? That motivating fun thing should kind of always come second on those visuals. Along with first then language, using visual schedules, right? So on to the right, I have a picture here of an exemplar visual schedule. But again, visual schedules just set clear expectations. So, okay, I know today's the first day of spring break. This is what our day is going to look like. We're going to go for a walk, and then we're going to come home and watch Miss Rachel, and then we're going to go have some lunch at, you know, Chick-fil-A. You know, putting, you know, the pictures or visuals are super helpful to our learners, and so that they can check off what they've done, they can see what's left. Having some fun, exciting things on there is also important too. I already talked about listing the rules. That's another strategy that's also really helpful. Also, another way you can prime your kiddos before an outing is showing pictures and videos of the location. So maybe you're going somewhere for the first time. Maybe you have a sibling who's graduating. Yeah, maybe there's a big graduation and you want your whole family to be there, and they've never had to sit before that long in a big auditorium with people, and there's graduates with hats on, and there's music, and it can be a lot, right? So maybe you prep by watching videos of what a graduation looks like and talking about it. Maybe, you know, showing pictures of it, so it's not the first time they're kind of seeing this type of environment. And then you can bring in my last point here, are social stories, right? So going with my graduation theme, maybe you're going to bring them to that outing, or maybe you're going on a vacation. You're going to go on an airplane, and that's their first time on an airplane in the community, right? So maybe write a social story about where you're going and what to do and how you can play fun things on the airplane. You can go on your iPad. You can have snacks. We're going somewhere super exciting. We're going to be in the sky, you know, showing lots of visuals and getting them excited about it, and kind of showing, you know, and prepping them about what's to come, bringing that story with you. so that they can be like, look, I told you we were going to get on a big airplane like that. So priming is really important. It's a really useful strategy. There's different ways you can go about it. And like I said, one size doesn't fit all, but sure, your child would benefit from using either some, if not all, of these different strategies that are listed in terms of priming for different items. And these would work for so many different outings, if not all outings. Okay. So the next strategy is what I like to call, or what we call, exposure trials. All right. So this is systematically introducing your child to challenging locations or environments. So this can take time, but it can help you and your child build confidence, right? It could take time because we break these steps really small. And I have a good example that we'll talk through together. We're going to break it down into really small steps and wildly praise them after each successful step that they master. So making it a big party. So an example I have here, let's read through this scenario together. Your child has a history of challenging behavior when getting haircuts. Even just the sight of the location in the mall can lead to behaviors. You decide that you're going to gradually start exposing your child to the hair salon one time per week with an end goal of sitting in the salon chair with no challenging behaviors. These are the steps you plan to take. So it takes some thought process, right? So you're going to sit down and be like, okay, my challenge here is just the sight in the mall of the haircut place is just scary to my child. I say the word haircut, they run, and it is messy and challenging. So we're going to break it up really small. And this is where it can take a little bit of time, but it goes a long way. I have been so successful with breaking this down with families and doing it step by step and getting them to tolerate haircuts to the point where they happily go and get haircuts and enjoy the experience. So we've paired it as a really positive thing. So for instance, let's say visit one, our goal is just for them to stand outside the hair salon. Okay. We don't want them to go in. We're not going to get a haircut today. We're just going to go to the mall and stand outside the salon. And I'm going to be prepared. If they stand outside the store for 10 seconds, I am going to wildly praise them and say, let's go downstairs and go to the play area. Let's go get Chick-fil-A. This is awesome. You can use some of that first, then language, like first stand outside for 10 seconds, and then we're going to go play. Let them know fun things are coming. Right? So it's important when you're doing each of these steps to kind of think about what motivates your child and what's exciting to your child. I had a family who we gave the child an option. So we ran this protocol and said, okay, the first step is to stand outside for 10 seconds. If you stand outside for 10 seconds, what do you want to do? Obviously, it had to be within reason, but the child said, I want to go bowling. So we're like, cool, we're going to go bowling if you stand there for 10 seconds. So stood there for 10 seconds, super proud. He actually was, after he did it, he's like, I'd rather go downstairs and play in the play place. So we ended up going and playing, which was awesome. He changed his mind. We were able to accommodate that, and it was awesome. The next visit we went and we prepped him. We said, okay, the next time we go, we're going to take 5 steps into the salon. Okay. We're going to walk in there, take 5 steps. If your kiddo maybe has difficulty with receptive language, you may not be able to explain it in full. You may, show like a reinforcer and kind of walk them in and then walk them out. But these can be adapted based on your learner. Of course, this is just an example. Walk in the salon for 5 steps. If they do it, hooray, party. Let's go get something really fun or do something fun or go play. Because we want to reward that behavior. We want that behavior to continue in the future. We want to build momentum there. We want them to know when they do these things, it's not going to be for nothing, and that they're, it's going to be fun. It's going to be okay. And it's not going to be scary, that you're going to be there. Visit 3, you're going to take 10 steps into the salon, maybe the next 15. The next step, maybe you just walk in and you're going to touch the salon chair. And the next time they're going to, sit in the chair for X number of seconds or minutes, right? And build it from there. So these are how we run exposure trials and just getting them used to the environment and getting them to know the environment's not scary and letting them know we're going to keep them safe. And obviously when we do these exposure trials too, we're going to build communication in there and some replacement behaviors, having them say, no, I don't want to go in. Thank you for telling me. Let's just try and then we can go. So communication is also important to bring in here as well. So we talked about priming, we talked about exposure trials. I love this one. So role playing at home goes such a long way. If there's a routine that's particularly challenging for your child, practice at home first to build tolerance. Let's talk a little bit, about going to the dentist, right? We want to expose them to the steps or the procedures that they could encounter, right? We want to simulate kind of what that environment is. So we want them to be able to touch and see and feel instruments that could be used with safety in mind. For a dentist, that could be some rubber gloves, right? It could be having them open their mouth and say, okay, I'm just going to count your teeth. Ready? And maybe they want to count your teeth, right? Say, do you want to do it for me? Maybe like giving them options of toothbrushes to use, or maybe they put on the toothpaste, and, role playing some of that can be so beneficial and make them feel confident and make them feel like they have some control and understand what's happening isn't so scary, right? It's hard when the first time they see rubber gloves on somebody is at a dentist's office, right? Or when they see a buzzer is the first time they're getting their haircut. It's loud, right? So getting them to kind of touch, feel, play, know that it's all safe, it's okay, is really important. And then making, this a gradual process and giving tons of choices and praise, making it fun, right? So, okay, do you want me to count 4 teeth or 3 teeth this time? Do you want me to count, 6 teeth or 12 teeth this time? Do you want me to pretend to cut your hair 6 snips or 2 snips? Which leads into giving choices and options is so important. Along with priming, exposure trials, role play, giving choices and options, so important throughout all our processes. So find ways to give choices and options no matter where you are. It helps to give our kiddos a sense of control. If you think about it, our kiddos are told all the time what to do all day long, right? And it's really important to find those opportunities that we can in the community to give them those options, right? So some examples would be like, do you want the dentist to lay your chair back or keep it upright? Do you want to sit in the haircut chair by yourself or on mommy's lap? Do you want her to cut your hair for 5 seconds or for 10 seconds this time? Awesome. I love that you made a choice, right? So being really enthusiastic about it, giving them some options is so meaningful. It gives them some of that control to realize that they're not just being told what to do constantly and that they do have a say in what's being done to them and their bodies, specifically, right, with things like doctor visits, haircuts, dental visits, those type of community outings. And you may be really surprised that, by giving options and decisions, they feel really empowered. Going back to, I had a kiddo who was working on tolerating haircuts, and we would practice, okay, once we got him finally to sit in the chair after lots of exposure trials and role play, and finally sat in the chair, we prepped the the haircut, hairstylist, I should say, and let her know, okay, I'm going to kind of coach you on what to do here. We would say, okay, do you want us to cut your hair for 2 seconds or for 5 seconds? And he would always at first say 2 seconds, whatever was the lower number. So it'd be like, okay, 1, 2, and then we would praise him so big for tolerating that. But eventually he was so excited by all the praise and having that control that as we started to go, okay, do you want 5 cuts or 10 cuts or 5 seconds or 10 seconds of a haircut? He would he would just pick the larger number. I want 10 seconds. So it turned into almost like a fun game where he was like, I have the power here, right? But in a safe and appropriate way. So I was surprised by that. I was surprised at how confidence was built when giving all those options and choices. And it just really went a long way for this kiddo. So really helpful, no matter what location in the community you're at, thinking of ways that you can give them options. All right. So today we talked about effective community integration and how it's essential for those with autism and their families and why it's so important. We talked about navigating community integration when a family member has autism and how it can be so difficult, but that there's strategies that families and caregivers can utilize, and also those strategies that we can teach our kiddos and work through those challenging situations together. And then we can work on, increasing tolerance, compliance, and increase overall quality of life for everyone. That's the goal here. So I hope that you take some of these skills and strategies today and, find, some confidence and try to start, nipping away at them with your own children. Remember, start small and, manage your expectations and create those SMART goals with your families. And I think all those things will take you a long way. So I wanted to see if there were any questions or comments or anything that anybody wanted to share in the chat box. We have a few minutes left, so if anyone has any questions, hopefully I can try to answer them the best I can.
I will be monitoring the question box for you. A question that came earlier in the presentation, but I think you answered through going through the different strategies. But one family had mentioned that haircuts have always been difficult. Any advice on how to address this? And I think you gave several pieces of advice on that. But if there's anything you wanted to add to that, while other people might be asking questions in the meantime, feel free. But please remember that the Q&A box is where you can type your questions in for Kaitlyn. And then Kaitlyn, if you wanted to just bump to the last slide while they're typing in their questions, I could just quickly give them some info about next month's presentation. Next month on May, which is crazy to think it's already May, but May 16th from 5 to 6, Dr. Stephanie Nostin, who is not only a BCBA, but also a speech pathologist, will be presenting on the importance of integrating speech and occupational therapy services into, a child's service delivery. And so hopefully you can join us for that. We'll be sending out emails within the next couple of weeks to allow for you guys to register. So we hope to see you there. And Kaitlyn, I got a question in the meantime here.
Excellent.
I have a question about nail clipping. That's been a real challenge for this family. So any suggestions on that end?
Nail clipping. That is an excellent one. I have worked on it in the past. Let's see. So this would be another area that I would recommend, some exposure trials, some role play where you're not actually cutting the nails yet, working on communication skills as well. So in the past, when I've worked on nail cutting, maybe I'm not sure if this is the case for your child, but sometimes the sight of the nail clippers just being around can cause problem behaviors and challenges, and they're trying to escape the situation. So I would first start maybe tolerating just the presence of the nail clippers, right? So maybe they're sitting on the counter and be like, oh my goodness, the nail clippers are just sitting on the table. I love how you're sitting there and, just looking at them. That's awesome. And then maybe removing them, maybe bring them a little bit closer the next day. Oh my goodness. Like, you're sitting at the table and they're so close to you. Nice job. I love how you're sitting at the table with your nail clippers there. I think then, you guys can, practice doing some role play in conjunction with those exposure trials, doing some role play of, okay, let's pretend we're going to pretend to cut nails today. I don't have the nail clippers, but we're going to pretend. Look, dad's going to try on me first. You can bring in siblings. Siblings are really great peer models, or other caregivers even, and they can practice on you saying, maybe dad is cutting mom's nails, pretending to, and then making it really exciting. And then maybe mom can pretend to do the child's, and then the child can pretend to do mom's, and, no nail clippers involved in that, but, just kind of play. You can also, watch some videos about it. And then thinking about, how you can give choices, right? Okay, today we're going to cut our nails, but remember, I'm only going to cut one nail today. Which one do you want? Do you want it to be your thumb or your pinky, giving some choices and starting small, like we talked about, right? We're not going to be like, today we're going to cut all 10 nails, right? Like, let's start small. Let's start with maybe one and give lots of praise and kind of show them, okay, after we cut one nail, you might want to pick something really exciting, something that you're willing to, give that's motivating to them. So maybe that's like, I don't know, maybe it's a donut, or maybe it's a special, game on the iPad or a video or something. So, okay, first you cut your nail, just one, and then we can have whatever it is. So I think in conjunction, all of those strategies together can work to help make tolerating nail cutting much easier.
That was great. I have two questions here. One of them was, can we have a copy of the slide deck? They would love that as a reference. We actually send an email out, usually give us about a day or two to get it out to you all. But anybody that's registered will get this recording from this evening. And we can also add in those slides, as long as Kaitlyn, you're comfortable with that, as an additional piece of resources for you guys. So great question. And then another question that came through is, when offering two reasonable choices, A or B, and the student child opts for choice C, it's usually, I don't want any seconds, or I don't want any minutes or snips. How do we reframe the question back without starting a power struggle? It's a great question.
That's a really good question. And that can get really difficult, right? So you can maybe have maybe like a choice board. Some visuals could be helpful, right? Maybe before you get into the challenging moment, right? Showing maybe a visual board of options that are reasonable, things they can have before we get any escalation. So maybe showing the board and be like, look, these are all the fun things today that you can pick from. These are special things. So is there anything else you think we should add on here? We're only going to use this board for whatever the outing is, maybe that you're trying to tolerate. Maybe it's going to the dentist, right? So when we go to the dentist, what should we add on here? Giving them some choices of things to add just to the board, and making it fun, and doing it like outside of when you're actually going, kind of as like a priming technique. And then, bringing it along with you. And this way there's, reasonable, some, more options on there. But I think, again, getting into a power struggle is definitely, like you said, a no-no. So sometimes, like, there may be times where you need to pause and, and whatever you're working towards, and go back and kind of look at whether strategies may be beneficial to your child if, choices are can be challenging for your kiddo. But I think involving them in picking some of the choices can be empowering as well.
Awesome. I also have a question here about food limit. So child eating limited food, and how you can expand on that. I don't know if that's something that you feel comfortable speaking to, Kaitlyn, but if you want to, feel free.
Yeah, so the limited food piece, I definitely would recommend. We do have a feeding therapy at Verbal Beginnings. Feeding is not my, forte, so I don't want to speak too much into that. But if it has anything to do with, different food varieties and increasing their variety of food intake, or increasing calories and things like that, I would definitely recommend consulting with someone who specializes in food therapy.
Awesome. I don't have any other questions that have come through just yet, but you can all we'll hang on here for another minute or so if anybody wants to stick around and ask any more questions in there. But if you got to go because we're at that 6 o'clock mark, I totally understand. I can't thank you enough for joining us tonight. We really appreciated your participation, your questions, and your ability to just get into this conversation with us about something that's so important. And a huge thank you to you, Kaitlyn. This was such amazing information in such a short amount of time. And I know that everybody can take something away from this. So I really appreciate that. And I got one question while I was talking here. So if you want to stick around for this question, feel free. But if not, I hope you have a great rest of your evening. And like I said, the next registration link is not yet active, but it will be sent out via email and on our social media page on Instagram. I'm sure it'll be on Facebook too, within the next week or so. So just keep an eye out for that. And then the question I got here is, I have difficulty helping my child who's 4 years old, regulate once he hits that sensory overload phase when we are at places outside of home. Things that normally work at home tend to not usually work at other places.
That's tough. That's tough. Yeah. So kind of building your toolbox. I'm sure it seems like you have some things in your toolbox at home that are likely effective, but maybe there's things like loud noises, maybe some repetitive behaviors they're engaging in the community. There may be some communication that we can build in there to ask for breaks, right? Whether it's through sign language or vocally, or right, and having a plan, right? So maybe they vocally ask for, or they use a PEX board or picture exchange to ask for breaks. We teach them how to ask for breaks because we know we're walking into a situation that maybe they do become more overstimulated from, and as you said, dysregulated. So teaching them to ask for breaks, finding places that, no matter where you are in the community, that you can maybe bring them to kind of take a few minutes to, become regulated, right? Or to get back to how they were. Maybe it's a few minute break in the car, or maybe there's a separate room in that environment where they can do something, for 4 or 5 minutes that they like to do. Building in some of those breaks more frequently may be beneficial. Giving them choices too of, okay, do you want to take a break in the car? Or do you want to take a break, in this room? Doing that. And then some other like strategies, some maybe like replacement things that you can utilize is maybe if sounds are a lot are really triggering, maybe you can bring some sort of like headphones that are, not stigmatizing, or some sort of fidgets that are something that they can hold instead of maybe flapping, or whatever the behaviors are that they're engaging. It may take some trial and error. It may not be something that, you come up with overnight, but it may be just trying some breaks, trying some options in regards to the breaks, giving that language, and, maybe some ways to kind of, desensitize and build up some of that tolerance.
Awesome. Thank you so much, Kaitlyn. I think we are good on all of the questions. Thank you for fielding all of those. Thank you to all the families again for joining us this evening, for participating in questions with us. I hope you all have a great rest of your evening, and hopefully we see you all next time. Thank you so much.
Thank you. Thanks for coming.